Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. There is a very real connection between sleep and health. Poor sleep can lead to poor health. But how can you tell the difference between a poor night's rest and a full-on sleep disorder? Today, we are meeting someone who traced his own concerning symptoms back to an undiagnosed sleep apnea issue. And we're going to hear what a difference some effective treatments have made in his daily life. And we'll highlight some evidence-based advice on how to get quality, rejuvenating sleep. Today, we are joined by two sleep medicine specialists, Dr. Saurav Luthra and Dr. Nancy Stewart. We also have over here Dr. Brent Massey, who's joining us in studio today. Good to have you. But today, you are always a neurologist every day, but today you are a patient. You are a patient of Dr. Stewart. So thank you for being here to share your story. You told us that about 18 months ago, you started noticing some changes in your health. So what exactly were you noticing, and kind of what was your level of concern?
Sure. Well, certainly early is very subtle. You're just kind of like, maybe your wife's like, you were kind of snoring a little bit last night, in the morning, kind of slow to get up. But things started to progress slowly over that period of time to where the snoring was really significant, or witnessed apneas or breathing disruptions in the middle of the night. It took me about 30 minutes to be like a functional human being in the morning. And toward the end of the day, I had difficulty concentrating, which is really not good because I work late into the evenings, and concentrating on medical records and charts was, difficult.
You got to go the distance.
Yeah.
And so interesting, though, your wife, and I would imagine partners often are the ones to bring things like this to your attention. Were you like, what? How? She must have said something, and you were like, well, what do you mean? Explain.
Yeah. At first, I was like, well, sorry, I'm snoring, but over time it was like, well, this is like actually an issue, So the other thing was in the morning, I just wasn't able to immediately get up and help care for our children, and so it was actually causing real disruptions.
Yeah.
Toward the end of that 12 to 18 month period, started to notice my blood pressure was going up.
Okay.
And it was kind of like, okay, we really have to see what's going on.
Now we have an issue. So what was your path to, I guess, first just getting a sleep study done to figure out what the heck's going on?
Super easy. Just went to my primary care doctor and expressed my concerns. He ordered the sleep study, which was at home. And then he said, if it's positive, we'll send you to the sleep clinic.
Okay, so I did a sleep study maybe 20 years ago. And yeah, they hooked up literally, 50 wires to my head, and I'm sitting there, and there's.
We still do that.
Okay, we still do that,
which I thought it was
okay, which I thought was kind of fun, and so they did all that. So, but now we have these at-home studies. So completely, I'm envisioning that completely different. So, what was it like doing it at home?
It was great. I mean, I guess I should have known it was at home, but I was a little trepidatious about having to do an in-lab study. And when I learned that I could avoid that, I was like all on board. So, doing it at home was super easy. Went to this office, picked up the equipment, took it home. It's a watch with a finger probe, and there's a chest piece that's taped to the sternum. You put it on, you go to sleep, and then that's it.
So who's a good candidate then for the at-home versus the one where you're hooked up and monitored over the night?
Most people are. Most people are. Folks that have seizure history, folks that have some heart failure history, folks that are on supplemental oxygen at night. We really don't want those folks doing home studies, and we can craft the documentation to usually get it paid for them to go in the lab, but most people can do it from home.
Dr. Luthra, what are these at-home and overnight studies? What are they really trying to find out?
So at-home testing is really a convenient way of finding out breathing disorders in general, and we know that a large majority of sleep disorders could be breathing disorders. So it's a really convenient technology to focus on breathing, oxygen levels, heart rate fluctuations, and we could get a good idea about the breathing disorders. But if you go beyond that, and if you're looking for sleep disorders such as leg movements, teeth grinding, waking up at night, issues with the dream episodes, then you're looking more into a polysomnogram, because it does give you much more data on that.
So is a breathing disorder, is that sleep apnea? Falls under that category?
Correct.
Okay.
So apnea would be one type of a breathing disorder. Yeah.
So Brent, what did they find that maybe surprised you during this study?
My sleep apnea, I assumed, was sort of on the milder spectrum, but I found that it was kind of in that moderate range, almost leaning towards severe. And I was like, wow, this is worse than I thought it was. And so I was really glad I got the test done.
So Dr. Luthra, what is obstructive sleep apnea? Why was it causing some of those problems that Dr. Massey was explaining? Just what is it? What's happening inside the body?
Yeah, absolutely. So obstructive sleep apnea is a type of issue where your airway is closing at nighttime, and that airway closure is what we call apnea. So what happens is when you are sleeping, your airway either partially or fully closes, and that can lead to a drop in your oxygen levels. In certain patients, it can raise their carbon dioxide levels at nighttime. And this is what then leads to a lot of downstream symptoms and signs we see, because we know that sleep works as a network. So when you are sleeping, it's a very active metabolic state, even though you are subconsciously in sleep. Your brain has to do certain functions, heart has to do certain functions, and all of them get disrupted. So what you are noticing is when somebody develops more than mild, moderate, or severe apnea, they don't get enough deep sleep, so that starts to impact their memory, their concentration, their mood. The heart rate has to work extra hard because every time the oxygen goes down, the blood has to be pumped even further. So the heart rate is going up, blood pressure is going up, and that doesn't allow the heart to rest. So then you start to see even more effects such as irregular heart rate, palpitations, higher blood pressure. And so that's how those dots are connected.
So Dr. Stewart, what else can happen if sleep apnea goes untreated long enough?
So interestingly, this morning I was reading my morning medical updates and I messaged Dr. Luthra how timely this was. There's a new study that just came out looking at premature aging in untreated sleep apnea. So there's lots of things that can happen, and that's just one of them. But I think most of us don't want to prematurely age.
No, no, I do not. No,
I would say, but you know,
is this what they mean by getting like your beauty sleep?
Well, yes. I mean, yes, you need 7 to 8 hours of nightly sleep, and if you're not achieving that, then that's
you have
an
3
issue.
kids. Good luck getting that. Right?
I do. I crash into bed. I crash into bed hard.
Yeah,
but that's a key thing. Like one of the things that we tell our patients is try not to nap during the day. Very few people actually need naps, and we want you to wake up in the morning feeling ready to go, and you know do your thing throughout the day, work throughout the day, let your melatonin levels rise, and when your melatonin levels hit their peak, it's gonna tell your brain, hey, it's time to sleep.
Okay, good. We're going to talk more about sleep hygiene, as they call it, how we can kind of get back on a good rhythm like that. But the standard treatment for sleep apnea are these CPAP machines, basically a machine that with a hose, a mask, it forces positive air pressure into your airways. So Dr. Massey, Brent, you shared with us that you were a little apprehensive, and I would be too. I always said it looks like an aviator mask. That's what people think of in their head. What was going through your mind when you thought, this is how I'm going to get through the night?
Well, I've interacted with a lot of patients who have sleep apnea that complain about their mask or have said, I just couldn't do it. I have sleep apnea, but I just can't do the mask. I was claustrophobic, I couldn't sleep, and all these issues. And I said, what if I run into that? I was worried about that. I'm like, how am I going to sleep with this thing on my face? And I was pleasantly surprised when I had the nasal cushion, I believe it is, and put that on and never looked back.
A nasal cushion. That sounds a lot better. That sounds
it sounds fancy.
It does. Sounds so comforting. But again, when people imagine a CPAP machine, this is really, if you look at your screen, this is what most people think of. Not all CPAPs are created equal. They've evolved over time. There's different sizes, different configurations. Dr. Luthra, we're seeing some here. Are there any tricks or techniques to help patients just get more comfortable with a CPAP?
Yeah, so I think mask fitting is a big first step. So first, making sure that you use the right type of mask that is most comfortable for you. And we really want patients to use nasal positive airway pressure. There's more data now showing that pressure gone through the nose is more natural and helps patients sleep better and has more positive impact. So we want to start with nasal masks more often. And then if somebody is having difficulties such as mouth breathing, dryness in the mouth, then there are other techniques. Rather than going to a full face mask like that, we could do taping of the mouth, which is becoming, we have more and more options for that. And actually more data came out that mouth taping with a nasal mask is quite effective. So I think mask fitting is a big first step to take. And then I want patients to just take it easy with CPAP. So even if they can get an hour or two of sleep with CPAP and then they remove it in the middle of the night, that's fine. We don't want patients to stop at that point. We want them to continue every night because it's sort of developing a new habit.
Yeah, get used to it.
Even if you do it a couple of hours and you keep doing it, then your usage should improve over time.
You mentioned tape on the mouth. What does that mean and what does that do?
So taping the mouth means you put a medical grade tape covering your mouth that doesn't allow your mouth to get wide open at nighttime. You still have an opening, so it's not like if the body wants to take some air in, you won't be suffocating. But opening the mouth wide changes the structure and anatomy back in this airway. And when that happens, your airway gets even narrower, and the machine has to give even higher pressure to get any air in. That starts the air to leak out from the mouth, and then all sort of intolerance develops. And that's a big reason why patients then stop using CPAP.
So if you're at night, some of us are night mouth breathers. I'm not, but my daughter is. I come home, she has her mouth wide open.
Yeah.
Is that like a precursor to that there's something going on, that that you start young and that this is going to be a continued problem?
It may not necessarily mean that their airway is narrow, but it would suggest that their nasal patency may be checked. Because body's natural tendency is to breathe through the nose. But if the nasal patency is not intact in terms of having allergies or just having anatomically narrower airways, then the body would try to breathe with the mouth getting open at night.
Okay, so you could get that checked if you thought that was an issue. So Brent, what's your overall health quality like now? Are you able to get up and help your wife get those kids ready and out the door?
It's been great. The CPAP has treated the entire family, as I said.
Yeah, exactly.
So yeah, I mean, I'm able to just immediately get up in the morning and start functioning, caring for my children, getting them breakfast ready, getting them dressed, and taking them off to school right out of the gate. And that's been a huge change, and really enhanced my lifestyle.
Able to push through the day. Still, how's that afternoon fatigue going?
Other improvements, yeah, I think were sort of neuropsychiatric, if you will.
Right.
Because my daytime alertness was okay despite having moderate sleep apnea. But what I discovered with treatment, and this was a big surprise for me, was a really nice increase in my mood and concentration, particularly toward the end of the day, which allowed me to sort of function effectively as a neurohospitalist late into the evening, on a day-to-day basis, doing 7-day stints straight, in the hospital. So those have been the main benefits I've noticed, and my blood pressure drifted down.
Good, good. You're very happy about this.
Yeah. Very happy. I've often been called a marriage counselor. So.
I bet, exactly. Bringing couples back to the bedroom.
We'll get you back together.
Exactly. So how do you know if you need to see a sleep specialist? What are some things that you notice? And then Dr. Luthra, I'll ask you as well.
You're having trouble sleeping, or someone else says that you're having trouble sleeping. Snoring is definitely something, but all snoring is not sleep apnea, and all sleep apnea doesn't necessarily have really loud snoring. So I don't want folks to think that that's equal.
I wake up at like the same time every night at like 2 o'clock in the morning. I go through weird things where either I'm waking up early or I can't get to sleep at night. It just kind of goes on a cycle. But when do you have to notice those little things? When you say, okay, this has been going on for 3 months, 4 months, 6 months, I probably should, or do you just wait for it to go away?
Say if you're not able to get, on average, 7 to 8 hours of sleep, which is what is recommended, that you need to start with your primary care doctor and say, hey, I've noticed some of these, because some of it is potentially behavioral patterns, and some of it is potentially untreated sleep disorders that, without a sleep specialist, you may not know, and you may think this is just my norm, I've been doing this forever, but if that person was dealing with whatever, if you're not getting that adequate amount of sleep, which is what the body needs.
Do you get it? Do you get it?
I try to. I very much try to. In fact, one of the sleep hygiene recommendations, having young children, that we all recommend is limit your screen time and such right before bed. And I am very adamant about that in our home. My husband and I go, we disagree on that quite a bit, but I am very adamant about it because I want my kids to be able to get upstairs, get ready for bed, and go to sleep within 30 minutes.
Yeah. Dr. Luthra, what about you?
Yeah, I think the daytime energy levels is a big clue. A lot of patients, because they have these sleep issues for a very long time, they stop focusing on how much they are sleeping, how much they are waking up. They sort of think this becomes a pattern for them, and they think like this is how their sleep is. But I would, that's why I suggest patients to focus on their daytime energy levels. If you feel like you're not able to do what you were able to do before, you're requiring a nap during the day, evening time you don't have the energy to complete your tasks, and then also focus on your cardiovascular health. So if you're noticing that your blood pressure is rising, or you feel more palpitations with less exertion than you used to do, then think that your sleep may not be fully effective.
I think I need a sleep study.
One other thing to keep in mind is that the hormones that directly regulate satiety and hunger and weight loss are directly related to sleep. And so many patients have trouble losing weight. And that's one of the first signs too.
I've heard
is
of
that
that.
they cannot lose weight, and then we deep dive and we
or
see.
unintentional weight gain is happening. You are eating the same amount of diet, same amount of physical activity, and then you are gaining weight. So that could be a hormonal imbalance that can be coming from sleep.
So let's talk about some sleep habits, also known, as we said, sleep hygiene. So let's go through some of these. The nighttime routine, consistent times for waking up and going to bed, dark, quiet environment.
Cold.
And cold.
Yeah.
Ooh, okay, yes, yes.
Not cool.
Cool. Okay. 1 hour away from electronics. Is that what you Is that pretty good? Okay, so avoid fatty meals. Avoid less. You get your stress levels down. Get more exercise. Do less caffeine. Oh my gosh, could you imagine trying to do all of these things?
Yeah.
That takes a lot of willpower.
Yeah.
One thing too, especially in this sandwich generation that many of us are in, alcohol and marijuana products have a biphasic effect on sleep, meaning that they can put us to sleep, make us drowsy, and make us feel like we're, I'm going to sleep really well tonight. And then they get metabolized, they wear off. And many patients have these middle of the night awakenings between 2 and 4 a.m. and they can't figure out, I've done everything else, what is wrong?
Right, that glass of wine in the evening to kind of take
It's
the
not just
edge
one.
off.
I think one is, one is reasonable, but it's those people that are, having a couple every night and then having these middle of the night awakenings.
Yeah.
And can't figure
Or
out
using
why.
alcohol as a type of sleep aid.
Yeah.
Yep, for sure.
Not a good sleep aid. Okay, so let's deep dive into a few of these, because limiting the caffeine, Dr. Stewart, how much should you have a day? We start early, I know I do. When should we cut it off? When's the cutoff time, you think?
I would love to hear what Dr. Luther says on this, because I would say what I say is going to be different for every person in my own experience. For me, I can have something at 2 to 2:30. If I have some caffeine past 3, I really don't.
Yeah, 2 o'clock is sort of the cutoff I give patients. I think and different patients have different caffeine sensitivity, but the half-life could be up to 7 hours. So you really don't want anything after 2 o'clock. And 200 milligrams, ideally, if you could limit that.
Oh, I can't.
Yeah.
I can't. I
I
can't.
can't.
do it, so.
Okay, but I'm going to work. I hear you.
Yeah.
Brent, what were you having to adjust? There's some things now that you have some answers. Are you changing some of your habits?
Sleep-wise, the main adjustments were chin strap. We're talking about the mouth closing piece. So I wear a chin strap to prevent my mouth from getting stone dry while I'm wearing the mask. You have to fiddle with the distilled water and put that into your machine, and so it humidifies the air that's going in your nose. But you just kind of build that into your routine. And
I bet it's totally worth it.
Yeah, I mean,
it's been a total life changer for you.
I mean, initially I tell patients, like treating sleep apnea and most sleep disorders in general, it is a behavioral change.
Yeah.
And almost everything in sleep medicine has some type of behavior attached to it that we're going to try and change. And so I tell patients it's like trying to turn an aircraft carrier. Like it's going to go slowly.
Yeah.
But it's going to go in the right direction if we give it time.
And think of all the other things that it's addressing, all the other issues that it's addressing, or keeping at bay other health issues.
Yes.
So, Dr. Luther, what should our nighttime routine look like? And are there other things that we can do, like a noise machine? I love a noise machine.
Yeah.
What about spraying different scents in your room and just calming effects? Any of those things work?
I think noise has more evidence than I think the aromatherapy. Aromatherapy also has some data, but coming from the manufacturers mainly. But I think noise definitely works for some people. Some people like it quite, completely quiet. So a good sleep hygiene or a good sleep routine is really what works for you. But some general principles should be followed, which is lights go dim after 8 or 9. And then a couple of hours before going to bed, you're just doing calming activities. You're not watching something exciting. You are reading, listening to music, doing some maybe breathing or whatever calms you, meditation. A warm bath works for some people. And just going to bed when your brain gives you a signal. A lot of us get into a habit where we fight our initial sleep signal because we want that extra hour. We worked all day. We want catch up on few things. So we need to listen, because that is our internal clock telling us that our brain is now ready to sleep. And if we miss that window, then it's harder to go into sleep, plus you get sleep deprived. So listening to that cue that you get, and then lying down in the bed and maintaining a good environment like you mentioned.
And I like it because it's really almost like any other routine you would do. You exercise, you spend an hour to go to the gym, you're doing all these other things. It's so different than getting your body ready for its sleep routine. So not easy to do, but it's worth the try for sure. What about melatonin?
So melatonin is effective when used in the right way. Too much melatonin can just make you more groggy after you wake up in the morning and make you feel like having a hangover. But in a right amount in patients whose internal clocks are not working in phase with their bedtimes, it can be extremely effective.
All right. Well, as we are talking with today's panel, be sure to ask your questions. You can use the chat on YouTube or Facebook, or you can email the Medical News Network. Information is right there on your screen. I also want to acknowledge that I am wearing white today in honor of Immunotherapy Day. We have brought you numerous stories on this program showing immunotherapy's life-saving potential. For example, CAR T-cell therapy or certain monoclonal antibodies. They use your own immune system to attack disease, and you can expect certainly to hear much more about immunotherapy over the next few years. And not just for cancer, but other diseases like lupus or sickle cell. It is just a really exciting time for our care teams and certainly for our patients. And we want to just say thank you to the thousands of participants that have been a part of clinical trials that have helped prove the potential of immunotherapy. So back to our talk today. We talked about screen time. We can't talk about it enough, Dr. Stewart. How much is that interfering with our sleep and our kids and our life?
I mean, I think a lot. I have not seen the most up-to-date data on it, but I can say by personal experience, it
ain't good.
It's not good.
Right.
You know, I occasionally will check my phone before I go to bed, and then I find myself 30 minutes later still checking my phone or reading some interesting story, and then 20 minutes later I'm like, oh my goodness, I've literally wasted 40 minutes, and I still am go during the day, so I'm typically able to just put it down and fall asleep within 5 or 10 minutes, but I know most people are not, so it's not good.
Yeah, screen time, and I think it's age dependent also. We know that kids under 3 years have a big impact of screen time on their activity levels, so that should be really limited. And then, you know, but I also think that screens have become so important to our work and lifestyle that it has you can't tell somebody to just be off the screens because, you know, you're writing your notes, you're doing your work, but there are things like you should do, which is cutting down the blue glare from the screens, keeping the brightness down as much as possible, not bumping up the brightness to the maximum at nighttime, and just keeping a distance. So if you can watch something on your phone versus watching something on TV with low brightness, that may have a lesser impact on your sleep cycles.
So screens have their time and place, but don't let them rob you
yes.
For sure.
of your lifestyle.
And almost all of them have the ability, like if you look in the control panel of it, you can narrow the brightness and time it so that it'll automatically shut down.
That's my big thing with my kids. I always turn that brightness all the way down.
I sometimes find myself turning it back up because I get frustrated.
Because we can't see. I can't see, but I don't want them exposed to all that. What's the true overall risk, Dr. Luthra, of just neglecting your sleep hygiene?
Yeah, so I think sleep is a chronic, health measure. So when you don't sleep well, you will see impact in your mood, your memory, like I was mentioning, on your cardiovascular health. We know now that aging is related to sleep loss. We know that it really affects your hormonal balance, and that can lead to a poor metabolic health. So right now, if you look at what health conscious people are doing, they are focusing so much on their metabolism, and sleep is extremely important to maintain that. So I think for all those measures, you should really focus on getting enough sleep.
What are some alternatives to CPAPs?
Oh, there's lots of them.
Yeah.
Good.
Surgeries on one end of the spectrum, and things like weight loss, positional therapies, oral appliances that are custom made by sleep dentists. There are a couple newer devices out. One's a tongue strengthening device. There's a nasal valve device. There's lots of cool new things that are coming on board. I would say, though, I have not yet seen anything that is considered a CPAP that does not have a hose and a plug-in. I've had a couple patients say, oh, I found this cool CPAP, but then they describe it to me and it does not plug into the wall and it does not create this positive airway pressure, and that is not a CPAP.
Yeah.
Dr. Luthra, did you want to add to that?
I just wanted to add the nerve stimulator device that is also available for moderate to severe apnea. It is not as effective as CPAP, but if somebody is not able to use CPAP completely off therapy, I think it's a great alternative for them.
What's the latest in research when it comes to sleep?
So a lot going on. I was at the sleep meeting this year, and so we are working on a number of things. One is we always use this number of episodes per hour to define somebody's apnea, but it doesn't correlate clinically with how symptomatic they are. So what I mean is somebody could be having 20 episodes an hour and they won't have any single symptom, and they'll only come because their spouse sent them. And somebody is having 6 events and they are just waking up and terrible and too tired. So this is not ideal. So as a sleep field, we are working on looking at other things like how low the oxygen was for how long time. So there's a lot of research going on there. A lot of AI and machine learning I saw in sleep testing. So we're going to see how the home testing evolves with the help of AI. We also are going to see in terms of sleepiness disorders, we've been using this NAP test for a very long time to determine that. But we're going to see that we could just use the overnight testing and better analytics on that to figure out who is more predictive to have a hypersomnolence condition. So I think a lot of work on diagnostic end. Then on the treatment end, I think the CPAP alternative devices, even this nerve stimulator I mentioned is going through evolution. It started as a 3-lead device, now it is a 2-lead device. They're going to convert it hopefully into a single lead device. So there's a lot of evolution there.
Let's get to some questions from our viewers. First one from Jenny. What questions do you wish that patients would ask their general doctor when it comes to their sleep health?
I think if they feel like they're not sleeping well, I want them to just bring up sleep with their doctors, because a lot of time during annual physicals, I don't think sleep gets brought up. You need to just tell them, or doctors need to have something on their questionnaire, are you sleeping well? And if the answer is no to a simple question, then just go into a bit more detail. That is going to lead to a lot more improvement.
A couple of viewers on YouTube have questions. Vera wants to know, how do you tell the difference between sleep apnea versus insomnia and stress?
Yeah, diagnostic testing might help in there, yes.
Okay. Question from Jeannie. Will treating sleep apnea help with a slow heart rate, like heart rate decreasing to 37 during sleep?
That reverse response in heart rate is not common, but can be seen. I would say talk to their cardiologist, but yes, it could help, yes.
Okay, Joellen wants to know if you could go into a bit more detail regarding heart health and sleep apnea, like AFib and apnea.
There's a lot of cardiovascular data that suggests that sleep apnea and cardiovascular health are very intricately intertwined. So untreated sleep apnea can definitely lead to heart rhythm and heart pump problems like AFib and aflutter, and it can also lead to heart failure down the road if untreated.
Pamela says, what if you're a stomach sleeper? I tried doing the sleep study at home and couldn't do it.
It's hard, isn't it? I'm a belly sleeper too.
Yeah, right. Is there a test for stomach sleepers, she wants to know?
So it's a great question. And what I tell patients is we truly only need approximately 2 hours of data on the sleep study. And when I was in training, I did a sleep study because I wanted to know what I was making my patients do. And I am a belly sleeper, and so I tolerated it for 2.5 hours, and then I ripped the thing off. Just being honest.
Yeah, I mean nowadays sleep studies, they should talk to their sleep physician. There are studies where you just basically wear a ring, and it can give you an idea of how much apnea you have. So position does not matter as long as you use a different technology.
A lot of options.
The other thing to note too is if you're treating a belly sleeper or a side sleeper with CPAP, there are lots of different hose and mask connections that will work for those patients. So the patient that we saw on the picture where it has this like full face, coming out the nose, that's not always the case. We do have some that connect on top of the head and they rotate nicely that way, and some are very low profile to the face so that there's nothing obtrusive in the face and people can bury their face in their pillow.
I like you explaining that, because I think there's people who may not want to come see you because they don't want to be told that they have to go on that.
Absolutely.
And then they're going to.
That's one of the first things that we talk about in my clinic when we talk about treatment options, and there are over 30 different types of CPAP masks. So if someone's willing to try it, there's usually something we can find.
Like Brent, willing to try it, to do anything to get back to life. What do you want the big takeaway to be from your story?
I think just having a low threshold to bring these things up to your doctor is the main thing. Sleep apnea is largely underdiagnosed, or at least we think so, and part of that is just because patients sort of just assume that what they're experiencing is their normal, and they just sort of
live tired.
Yeah, and so really have a low threshold to bring up these issues.
And you're a neurologist, so how does that, if I just have to ask you, how does lack of sleep affect the work that you do in your patients?
Yeah, this is why I love talking about this, because it affects me personally and professionally, but we know that there's a complicated relationship between sleep disordered breathing and obstructive obstructive sleep apnea with neurodegenerative disease, like Alzheimer's disease, Parkinson's disease. Now that relationship is very complex, and we're learning more about it all the time. But we certainly think about that because not only is it thought to be a risk factor for the development of those disorders, but it also is thought to accelerate those processes once they begin.
I feel like the good news about this conversation is it's sleep, so it's something you have in control. Absolutely. If you are determined to to at least have something in your control when it comes to your health, there's a starting point there.
Well, and we sleep for a third of our lives.
Yeah.
I mean, we spend a third of our lives sleeping.
Make it quality.
Yeah. Absolutely.
Yeah.
What else is the takeaway, Dr. Stewart?
I mean, I can't echo what Brent said enough.
Right.
Like, it's very important, and like I just said, you spend a third of your life sleeping, so, make it quality. And if it's not quality, and if you feel like you're not getting what you need, like, you deserve that.
Yeah, don't let it rob you.
Yeah.
I like that. Dr. Luthro, what's the big takeaway today?
I think, we need to look at sleep just like we look at other preventive medicine. We check our blood pressures at our doctor's office. We check our weight every day. So think of sleep in that terms. It's a preventive measure. If you have good sleep, a lot of things that you are checking in terms of prevention are directly or indirectly related to that.
All right, it affects us all. So thanks to all of our guests for being with us today. We appreciate it. Brent, thanks for sharing your story. Thanks to our viewers.
Thank you.
Have a great weekend. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update. Zach Craig thought he had just torn his rotator cuff, but when pain persisted after surgery, the competitive strongman learned he had a rare cancer, requiring a rare treatment. I'm Jessica Lovell. On the next Morning Medical Update, curing cancer by replacing a shoulder blade. How Zach left his doctors in awe at his very first follow-up. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.